वासुदेवाय धन्वंतरे अमृतकलशहस्ताय सर्वान्वय विनाशाय त्रैलोक्यनाथाय महाविष्णवे नमः. Oh Lord Dhanvantari, please shine something upon us so that we can reflect the world. A very warm welcome everybody, and thank you very much Dr. Kirti for a nice introduction. So without wasting much time, we'll come back to our basic topic, which is Ayurveda, the timeless science of life. So basically regarding Ayurveda, we need to understand the authentic Ayurveda. So what Ayurveda is, it is basically a science of life with its two main aims. The first is Swasthasya Swasthya Rakshanam, and second is Aturasya Vyadhi Parimokshanam. It's health maintenance and treatment of disease. In fact, more than 70% part of Ayurveda is focusing the first aim, health maintenance, and rest less than 30% part is focusing the treatment of diseases. Nowadays, that wellness industry across the globe is booming like anything, which is absolutely based on this concept, health maintenance. So when we think of our culture, Sanatan culture, Indian culture, this is what we have. Sarve bhavantu sukhina, sarve santu niramayaha, sarve bhadrani pashyantu, ma kaschid dukkha bhagave. May all be blessed with health and happiness. Let there be no trace of sorrow anywhere. Ayurveda definitely is a holistic science where we never consider only the body of that person, but in fact we consider body, mind and soul as well, or spirit as well. So this is the holistic approach by both ways, both means holistic and holistic, whole and holy as well. So when we think of Ayurveda, the main aim of Ayurveda, the treatment, is to achieve a perfect health. It's not only the treatment of diseases. We never treat a disease in Ayurveda, we always treat a human being. So the main aim is health. Now regarding the road or the pathway to that health is a four-folded approach. Dietary corrections, lifestyle changes, medicines and detoxification or panchakaram. Now what's this? Regarding the dietary correction, it's again interesting to know that most of the people think that when they come across this particular dietary corrections, they think that Ayurvedic doctors, they generally stop everything and advise to eat just like boiled stuff. It's not true at all. In fact, in Ayurveda, what to eat is not that important, but when to eat is really very important. And there's a concept of an Agni or digestive fire which is placed in the stomach. It is literally a fire. Now, why that fire is kept in the stomach? The reason behind that is very scientific. Normally, this is the only route of nutrition for our body. Now, in that route, the digestive fire is kept. Now, why? Fire, being the most pure thing in this universe, it has got two distinct abilities. One, it has the ability to digest. Second, it has the ability to purify. So, obviously, when a person is properly hungry and that person consumes food, that food passes through this properly lit digestive fire. All the impurities are burned. At the same time, it is digested properly. That's why this digestive fire is very important. So obviously one must eat when that person is really very hungry. That's the basic of dietary correction according to Ayurveda. So it's very clear that like if a person is not at all hungry and that person is consuming the so-called most healthy food of the universe, neither that food is going to get digested properly at the same time, nor the impurities will get burnt out. So that though it is the most healthy food, but still it is going to harm that person. Exactly opposite to this, if that person is really very hungry, getting crazy out of hunger, and if that person gets some junk food to eat, what will happen? As the digestive fire is so strong that it will burn all the impurities from that junk, it will get digested properly. So definitely it won't harm that person because the appetite was very strong, the digestive fire was very strong. Yeah, it's a different story that that person is going to get very little nutrition out of that, but it won't harm that person. So Agni, the digestive fire, the appetite is very important according to Ayurveda. This Agni, the digestive fire, goes with the sun. So it's very clear that one must eat a proper healthy, heavy breakfast, as the strength of digestive fire is going to get increased with the sun. In the noon is at the peak, so one can consume proper food. In the evening, after the noon, it is going to decline gradually. And it is scientifically proven that after 10 p.m., our digestive system works hardly 15% of the day. So it's very clear that one must consume a proper heavy breakfast, lunch should be proper, and dinner should be. So that saying or the famous proverb, breakfast like a king, lunch like a prince, and dine like a beggar, is basically originated from Ayurveda. So it's very clear that appetite is a natural instinct. One should never ever disrespect that instinct, because in normal course, look, it's very clear that even a baby of few days knows when to eat and when not to eat. It's an inborn instinct, it is never taught. If the baby is not hungry, that baby will not accept the food at all. And though we are grown-ups, highly literate, but normally most of the people, they disrespect this natural instinct. Both ways. First, like most of the people eat food just for the sake of keeping that particular time, like it's time for breakfast, lunch or dinner, and they eat. They hardly think of actual appetite. Sometimes it is exactly other way around. Sometimes like we are very hungry but busy with something. The first impression, let me complete or finish this work, then I'll have food. But by the time we complete the work, that natural appetite is subsided. It is compromised, obviously. So this is how most of the people, they disrespect and they have to pay for that. So this is what the dietary correction according to Ayurveda is. Just few examples after this. Like nowadays, it's very common that most of the people, they consume cold drinks or fizzy drinks with fried stuff. Actually, for the proper digestion of fried stuff, that fat has to be emulsified, and for the emulsification, heat is very important. So whenever you consume any fried stuff, one must consume hot drink or hot water instead of cold drinks. This very beautiful quotation, beautiful slok from R.A. Chanakya's Niti Shatak. Ajirne Vishram Vari, Jirne Vari Balabradam, Bhojane Chamratam Vari, Bhojanante Vishabradam. So it's very clear that when a person suffers with indigestion, ajirna, in that case, hot water is the best medicine. So that person should consume hot water sip by say until that person gets really hungry. That's the best treatment according to Ayurveda for indigestion. Jirne Vari Balvadam, after 1 or 1.5 hours of consuming food, that water is definitely helps to strengthen the body. Bhojane Chamratamari, during, like while you are consuming the food, drinking water sip by sip is really very good for the digestion for the body. And Bhojanante Vishabradam, drinking significant amount of water immediately after the meals is very dangerous, because it dilutes the digestive juices, interferes the process of digestion. So these are a few examples. Going next slide, regarding lifestyle. So there are many people, when we ask them, do you do any proper physical exercise, they say they know, we do yoga. Now, as far as yoga is concerned, the definition of asana is very clear. Sthiram Sukham Asana, the position of body in which you are stable and comfortable is asana. But the definition of exercise, Sharir Ayas Janagam Karmam Vyayam. There is workout, sweating. So both are important. Regarding lifestyle, nowadays this is the most important part everywhere across the globe. So we need to lead towards wellness from the stress. And for that, the most important thing is the positive approach. When we say regarding the stress management, again, it's quite complicated, but what I message is it's very straightforward: a sound mind in a sound body. So if your body is perfect, if your physical health is perfect, obviously your mind is going to get perfect. Because most of the time, the reaction of mind is hardly decided by the external factors. It is mostly decided by the internal factors. Like if you are not feeling well, you get agitated very quickly. Even with smaller things, you react very quickly. Exactly opposite to this, if you are fit, then that tolerance is obviously really very good. So ultimately, regarding diet and lifestyle, what I may say is, there's a very famous quotation, a slok. If you see the two lines, both lines are absolutely same. Pathe sati gajarda sikin aushad nishevanahi. Second line is Pathe asati gajarda sikin aushad nishevanahi. The person who follows proper diet and lifestyle will hardly need a medicine, and no medicine will ever help the person who does not follow. Now the next thing, Look, in Ayurveda, medicines comes at third place. It's not the first thing to start with, like other systems of healthcare. So as far as medicines are concerned, whatever treatment we do, those treatments are not only for the treatment of the disease, but at the same time, perfect health has to be restored. Now, coming to the fourth step, it is panchakarma or detoxification. This concept is very scientific. Let us discuss this concept with an example. It's like we clean our house almost every single day, but at the time of any occasion, like any festival or wedding, when we clean it completely, kind of thorough deep cleaning, we find a lot of dust, debris, garbage inside. Exactly same way we throw many waste from our body in different forms like stools, urine, sweat, gases, but something remains inside, and that something is collected over a period of years. Now, we do clean our house at least once a year, deep cleaning, thorough cleaning. We do service of our vehicles regularly, but we hardly think of cleaning our own body. And basically, human body is made of billions of pipes. So, obviously, whatever the waste they are collected in the body, these waste get stuck into these pipes and certain blockages are created. They have certain consequences as well. The first consequence, whatever the nutrition we eat, that nutrition doesn't reach to each and every part of the body in adequate quantity. That leads to weakness of certain body parts. It's a very gradual but continuous process going on in the body since years. In other words, we call this as the process of aging. So more the blockages, more the rate of aging. Now the second consequence, the collected thing in the body is a waste, which is not good at all. So after some time, these wastes turn into certain toxins, and these toxins start interfering the basic metabolism of the body, and by interfering the metabolism, initially they create little problems. If ignored, they may lead to major diseases as well. So it's very clear that one must go for a proper detoxification to remove possible maximum toxins from the body and to open up the blockages. Again, why this is necessary? Because if you don't go for this, if you start with medicines only, even the medicines will not reach to the expected sites of their action because of the blockages. And once we do proper detox and the system is pretty open up, after that medicines, even in smaller doses, they work very properly and efficiently. So this is the basic concept of panchakarma detoxification. Obviously, most of the people, they have very wrong impression that they think that this massage, abhyanga and steam is panchakarma. Definitely it's not panchakarma. It's the pre-procedure for panchakarma. Whenever we plan a detox, for that detox, we need to prepare that person's body for that particular detox. And that preparation is achieved with massage and steam. So, panchakarma, they are at the name, as the name suggests, these are 5 different procedures. Vaman, Virechan, Vasti, Nasti and Raktamokshan. Now, it is simply impossible to go for all the 5 procedures at once. So, the procedure of choice is selected according to the need of that particular person's condition and body as well. Many people think that panchakarma is only for the treatment of disease, but yes, definitely it's not at all true. Panchakarma can be performed for health maintenance as well. So with this approach, the treatment of Ayurveda has got very extraordinary strength in different conditions, ranging from health maintenance to treatment of diseases. So there are certain areas where Ayurveda has a lot to offer. We have very promising treatments for conditions like all autoimmune diseases, then disease of the respiratory tract, disease of the locomotor system, joint disorders, disease of the skin, then yes, obviously infertility and gynecological disorders, and yes, for psychological disorders as well. These are few examples. Yes, there are many areas where Ayurveda has a lot to offer to humanity. Even this area, lifestyle oriented disorders, now these disorders are increasing like anything. So basically, our center, Brahma Ayurveda, is like world's first and only Ayurvedic urology center. So we are managing different conditions at our institute with pure Ayurvedic treatment. So welcome to world's first and only Ayurvedic urology center, Brahma Ayurveda, which is in Gujarat. So just let me explain few conditions, the way we are working in the field. The first condition, this condition is called as urethral stricture. In this condition, the pipe of urine, that urethra, which carries urine from bladder to the exterior, is blocked. Like this kind of blockage is there. So whatever they do for this condition, there are different techniques to open up this blockage. Either by introducing different size rods under anesthesia, initially they introduce a smaller, then bigger to open it up. Or the second option is they go for a surgery called as DVIU, direct visual internal urethrotomy. So in that they introduce a scope, then that constrictor is cut to open it up, or ultimately the final is the urethroplasty. It's a major surgery, it's an open surgery in that they open up urethra, that constricted part is excised, removed, and they use inner skin of the cheek to reconstruct it. It's called as buccal mucosal graft reconstructive urethroplasty. Whatever they do, this disease is famous that it recurs within almost 1 year of the surgery. That's why it is officially written in the textbook of urology that once is a stricture, always is a stricture. So this is the known limitation of conventional urology, though they have so much advancements in the science, but still treatment of this disease is a challenge. So what we do in Ayurveda, there are few treatments, highly specialized Ayurvedic urology treatments like Uttar Basti, then calibration of urethra, then certain oral medicines, that to Ayurvedic medicines. Now this treatment, in this we introduce certain oil-based medicines into the bladder through urethra. This procedure is absolutely painless. Obviously the procedure has to be conducted under very rigid aseptic precautions. We have treated patients of age ranging from 5 years to 96 years within the last 22 years. So you can imagine from that kid of 5-year-old, it's absolutely painless because we need to do 20 procedures, 20 sittings of this treatment for this particular disease. This medicine goes to the bladder and from there it works. We introduce generally 60 ml of the medicine. Now just let me show you the results. In case of female also we do the same, we introduce medicine. The most important part is there's no need to introduce a tube or a catheter into the bladder for this procedure. So this lady, we have this lady from USA. She was suffering with this disease since more than 12 years and has to undergo dilatations every 6 months. Otherwise she used to suffer complete blockage of urine retention. On 15th of October 12, she suffered complete blockage of urine, that is retention, when she approached nearest emergency in California. When they tried to introduce the smallest tube, they couldn't introduce even an infant feeding tube of the smallest size. So obviously, as an emergency treatment, they needed to introduce a suprapubic tube into the bladder by piercing the stomach like this, because that urine has to be evacuated at any cost. After that, after a series of investigations, in December she was advised to go for the urethroplasty. When they actually posted the surgery on 23rd of January 2013, when the urologist tried to introduce 10 French pediatric cystoscope, the smallest one, they couldn't introduce it for more than 0.5 centimeter. Then they tried introducing a guide wire which is thin like the lead of a lily pin, that thin. They couldn't do that. Then they took the suprapubic approach, the tube, through the stomach, through that hole, they introduced a scope, flexible ureteroscope. They tried to negotiate urethra from that angle. Even through that, they couldn't introduce the guide wire. Obviously, they have to abort the procedure. They explained that lady and her relative that she has to lead rest of her life with this tube only. So, in short, this is incurable. So, what next? Because most of the people believe that once the doctors of US say that there is no hope, that means there is no hope at all. Then they search on the net, they got our website. The domain itself is cureurethral-stricture.com. There is an online consultation. This is how people contact us. So it was very hard for them to believe, and we have a policy that unless and until each and every doubt of each and every patient is absolutely satisfied, we never start the treatment. We are open for any kind of discussion with anybody, and that's why till date we have many so-called modern consultants as our patients. We have patients who are physicians, surgeons, gynecologists, pediatricians, and I would say a cherry on the cake, one of our patients, he himself is a urologist. We managed his stricture 8 years ago, and since then he is leading absolutely normal life. So that lady ultimately came to us. We started the treatment. Within 10 days of the treatment, on 29th of April, we were able to remove that suprapubic tube. A lady was unable to pass even a single drop of urine. That lady passed urine with a max flow rate of. So this is an important investigation called as uroflowmetry. She passed urine with a max flow rate of 16.8 ml per second. This should be at least 15 ml. The average flow was 12.4. This should be at least 10 ml. That too without screening. So this is definitely possible with Ayurveda. Not only this, but A lady who has to undergo dilatation every 6 months, otherwise she used to suffer complete blockage or retention. After the treatment, she went to US. She came back after almost 3.5 years. April 13, December 17. Even at that time, her flow was absolutely normal without any kind of treatment afterwards. So, you just see this, April 13, we managed her. This is November 2025. So it's been more than 12 years that lady is leading absolutely normal life. So this is how we are challenging that belief that once is the structure, always is the structure is not at all true. There are many testimonials on our website. You can just log on to the site and see the testimonials. So this guy from South Africa, he gave like very beautiful testimonial from his side. There are 2 testimonials from the same guy. Initial testimonial immediately after treatment, and the next testimonial after the 5 years of the treatment. So he is leading absolutely normal life. Now the second condition called as bladder outlet or bladder neck obstruction. So normally, like nowadays, a thing is very trending everywhere, unfortunately, that if the restrooms are unclean, one should not use such unclean restrooms because they may cause infection. This is what a common belief which is trending everywhere, viral, getting viral. Now, this kid must have heard that discussion somewhere, and as kids are very sensitive, so he thought that the restrooms in the school are unclean. So he used to go to school by 7 a.m. He used to come back from the school by almost 3 p.m. and used to hold urine for those much hours every single day for almost 4 years. And the result was, look at his bladder. This huge bladder. The size, if you see the size of the bladder, 1081 cc. For an adult, the normal size is 4 to 500 ml. For a kid of 9-year-old, it's 250 ml. So his bladder was more than 4 times the normal. And the amount of urine remaining after passing urine was 836 ml. With significant pressure, back pressure changes on both kidneys called as hydronephrosis hydrourethra. That kid was obviously advised to go for a cystoscopic surgery to release that constricture, that narrowing, by 2 urologists, 1 nephrologist and 1 pediatric surgeon as an emergency treatment to preserve or conserve the kidneys. The way that family was explained that if you could do it today, then don't wait for tomorrow. Being a single kid of a very rich family, obviously everybody was worried and they started searching alternative option. This is how that family came to us. We started the treatment. Obviously it was very challenging for me first to convince the family, then the kid. But fortunately I could do that. Look, after our treatment, after 8 days of treatment, his bladder capacity reduced to 460 from 1081. The remaining urine, which was initially 836, now it is 130 only. With significant improvement in the back pressure changes. After 22 days treatment, the remaining urine was only 4 ml. With completely reduced back pressure changes on the kidneys. So this is what Ayurveda can do. Actually, this condition do not have promising treatment because I got one more patient. That kid, he was, when we treated in August 23, he was just 10-year-old. His father is an interventional cardiologist. He's from Jabalpur. Unfortunately, he came to us after 1 surgery. And when they performed the surgery, within 1 month, the symptoms were back. There was an aggressive relapse of the symptoms within 1 month of the surgery. And then he came to us. Again, it was very challenging for me to convince his father, being an interventional cardiologist. Then they explained everything. This is how we started the treatment. And since then, since August 23, that kid is also leading absolutely normal life. So we have this concept of an energy in Ayurveda. In Ayurveda, what we believe is there is an energy which we call Apan Vayu. Like generally when we perform yajna in Sanatan culture, Sanskriti, we do yajna and in that we do ahuti, saying that Om Pranaya Swaha, Udanaya Swaha, Vyanaya Swaha, Samanaya Swaha and Apanaya Swaha. So there are 5 distinct energies which govern very significant and important functions in our body, out of which the Apan Vayu, the last one, is supposed to be the most strong energy. In fact, it nourishes rest of the energies. Now this energy Apan Vayu performs 5 distinct functions in human beings. It governs the physiology or normal functioning of urination, defecation, then ejaculation, menstruation and pregnancy. So the speciality of this energy, the same energy is responsible for holding all the 5 things up to certain limit. And once that limit is attained, the same energy expels them out. Like for urine, unless and until almost 4 to 500 ml of urine is collected in the bladder, we are unaware of that. Means this energy is holding urine inside the bladder with ease. And once that limit is attained, the same energy gives us the urge, the sensation. As soon as we go to the restroom, the same energy expels it out with ease, without efforts. It's like we go and come. It's that easy, and bladder gets empty. Same with stools. This energy is holding fecal matter into our intestines for almost 24 hours. And once that limit is attained, the same energy gives us the urge. As soon as we go, just remember, whenever we get a proper bowel movement, it never takes more than 2 minutes. It's like this, quick. It's in fact a reflex action. Defecation is a reflex. Same with ejaculation while having their sexual activity. The semen is held by this energy up to a certain limit. Once that limit is attained, the same energy Apan Vayu expels it out with force. Same with menstruation, the innermost layer of the uterus, that endometrium, is held by this energy for almost 28 days, and once that limit is attained, obviously this energy shares it off in the form of menstrual bleeding. Same with pregnancy, this energy is holding that fetus for almost 9 months. And once that limit is attained, the same Apan Vayu, the energy, induces labor pains, and the process of labor starts and delivery occurs. So this concept is only in Ayurveda, and that's why that energy, we need to rechannelize that energy. The way that kid was disrespecting that energy, that's why he suffered like this. So it's very important, the way Ayurveda says, na vegan dhare na udire. That means one should never ever disrespect the natural urges. And that's why it is believed, especially in urology, in my field, we believe that passing urine saves your life. What we believe, passing urine saves your life, is like very common scene in India, just out of joke. Passing urine saves your life. Now the next condition, again this condition, interstitial cystitis or painful bladder syndrome or Hunner's ulcer or Elozy ulcer, is again one of the most nasty conditions of this area. Patients suffer like anything. You can just imagine the frequency is up to 60 times a day. And each time that urination is quite painful. Dysuria, significant dysuria. Just let me present one patient's case. This guy from Mumbai, he came to us for the treatment of the interstitial cystitis. He was suffering with that particular condition since 4 years. Obviously, being a businessman, he was treated by all topmost urologists from Mumbai. By all means, conservative treatment. Then there is one treatment called as hydrodistension. They introduce certain drugs into the bladder to inflate it. Then they did this intravascular cocktail therapy as well. No relief at all. The bladder capacity was reduced to only 117 cc, and that patient was advised to go for augmentation cystoplasty, which is a major surgery. In that they use parts of our intestine to resize or reconstruct the bladder because the size was reduced. Bladder was shrinking. When he asked, will I be okay after this surgery? They said maybe. So obviously the patient was not at all ready, and then he came to us. We started the treatment, totally Ayurvedic treatment for this condition. Just let me show you. This is supposed to be one of the most important criterion to judge the patients who are suffering with interstitial cystitis. Is bladder diary. A measuring flask is given to the patient, and that patient is asked to note each time when that patient pees. That patient has to pee into that measuring flask, and he or she has to note down the time and amount of urine passed. So initially you can see the frequency was very high, the quantity was very low. Then on the 4th day, for the first time, he could write 210 ml of urine when the bladder capacity was only 117 cc. At the end of the treatment, on 21st day, he could write 400 ml of urine. So the capacity was normally, naturally restored without surgery. So this is definitely possible with her. Now in this case, what is happening? This energy, Apan Vayu, is unable to hold. That Apan Vayu is not holding urine up to the normal limit. So obviously we need to rechannelize that energy, and this is possible. And we treated him in October 2016, and since then this guy is leading absolutely normal life. We have many such patients. One of them, that lady is a doctor. She was suffering with this condition since more than 8 years. She remained unmarried because of this. Now she is happily married, fortunately, and obviously the credit goes to Ayurveda. There is one testimonial on our website for this condition. A lady from UK only. She is of Gujarati origin but UK citizen, Meena Patel. We treated her in 2021, and since then she is leading normal life. Actually, she was suffering with this condition since 8 years, more than I think 10 years. Was treated by all possible measures, no relief, but now leading normal life. The next is, I always used to say, the most burning issue of the modern era: recurrent urinary tract infections or multi-drug resistant urinary tract infection. Yes, in Ayurveda, we have very promising treatment for this condition. Just let me present one case in front of you. This guy, his daughter is a doctor, was suffering with typical urinary tract infection since 2 months. Obviously, being father of a doctor, he was initially hospitalized and treated with parenteral intravenous antibiotics for 15 days, followed by he was consuming oral antibiotics, rest of the medicines, but no relief at all. When he came to us, you can see, on arrival, there were significant lower urinary tract symptoms. Along with that, fever with chills and rigors. The body temperature was 104.3 degree Fahrenheit. If you see the blood pressure, it was very low. We call it as septicemic hypovolemia. So we do accept such challenges as well in our routine practice. So we secure the IV line to manage that hypovolemia if needed. Now, so what is the treatment we do? We introduce large bore catheter to address that condition, and we do the bladder wash. In that, we introduce different medicines into the bladder through that catheter, and the bladder is washed. And certain Ayurvedic medicine, we stop all the allopathy medicines. The patients get stabilized within 24 hours. And just let me show you. When that patient came to us on 15th of July, after a treatment of almost 2 months, his total count, WBC count, white blood cells count, was 20,180. That huge. The normal is up to only 10,000. So this shows that there was significant infection even after 2 months treatment. Within 4 days, on 19th July, with only agri treatment, his count was 6,610. So this is definitely possible with Ayurveda. So obviously Ayurveda has a lot to offer in this field. Like on our website there is a tab called as we also treat. So there are different conditions we manage with Ayurvedic treatment, including the enuresis, like bedwetting, incontinence, the patients who do not have proper control on the urine, then hypotonic bladder. So such conditions, definitely we have very promising, for all these conditions we have very promising treatment in Ayurveda. That too quick, that too non-surgical, painless. For me, this is very important slide for everybody to know regarding the preventive measures. The first point is proper water or liquid intake. Actually, it is never in terms of liters, because the need of fluid or water of a person's body can never be decided by a doctor. It is always decided by that person's body only. Like if a person is staying in cold climatic conditions, perhaps 1 to 1.5 liters may be enough. The best judge or indicator is the color of urine. So it should remain near to water. A slight yellowish tinge, straw yellow is fine. It should never ever turn yellow or dark. That's dangerous. So to keep your urine just like water, it's very simple. Always observe your urine. Unnecessarily, one should never drink unnecessary lot of water. So for a person who is working in the sun, especially in the summer, perhaps 10 liters will not be enough. And for a person with cold climatic conditions, 1.5 liters will be more than enough perhaps. So that's very important, that one should always observe the color of urine. It should remain always near to white. Then one should never disrespect the natural urges Local hygiene is very important. Safe sexual practices. Avoid cold drinks. Cold drinks, yes, the most worst thing for all urological conditions. Avoid stale or leftover food. Avoid late nights. One should not remain awake late nights. That's very dangerous for urinary tract diseases. Then one should avoid sleeping during day. Regular physical exercise, yoga, especially that Parvati asana, butterfly, sitting on the ground, holding the legs, touching the soles together, and this butterfly is really very helpful for most of the conditions of the pelvic conditions. It's really very helpful. And yes, Vegidhara means holding urine is really very dangerous. So ultimately, the purpose of this talk, the take-home message is very clear, that using all these basic points, using Ayurveda in day-to-day life, what we can do is, if we use all these things wisely, properly, obviously the outcome could be this beautiful. This is very important. And ultimately, Ayurveda is not only for adding years to the life, but for adding life to the years. The way our Honorable Prime Minister has launched a program called Heal in India, Heal by India. In fact, in 2022, to promote this particular program, a consultative meet was organized in Delhi. 50 hospitals across the country were shortlisted, and we are one of them. We have patients from 26 countries till date at our institute. We have patients from each and every state of the country, each and every state of India, but at the same time from 26 countries. Once we had a team of Japanese doctors to our institute to learn basics of Ayurveda under the guidance of Honorable Dr. Hari Shankar, Professor Hari Shankar Sharma sir. He is my Dadaji. And I was invited to Japan to deliver a lecture regarding Ayurvedic urology. Different urologists from different countries, they came to our institute to know about Ayurvedic urology. This lady, she is from Japan, urologist. Then this guy from Russia, this guy from Singapore, Egypt, Algeria. They especially visited our institute to know about Ayurvedic urology, and they really appreciated the way we are working in the field. It's a matter of pride for all Ayurveda scholars that I'm honorary consultant of Honorable Governor of Gujarat. Actually, being the Governor of Gujarat, he has got his own medical team, medical panel, on which there are 40 topmost consultants of the state. And still, I got the opportunity to travel with him on his private jet. And that is only because of Ayurveda. So Ayurveda has that potential, definitely. This is our team at Brahma Ayurveda. We are 5 doctors and rest of the paramedics, etc. We have 2 centers. One center is at Delhi. So this center at New Delhi is managed by Dr. Namadhar Sharma sir. The name is Preventive Research Institute and Hospital, which is in Rohini. That this hospital is spread over an area of almost 10,000 square meters. You can never believe that this kind of hospital could be there in Delhi. A lush green hospital in the city of Delhi, with all basic facilities, with world-class standard rooms, with all available Panchakarma and Panchakarma treatments. Managing this institute since almost 35 years. And he has patients from many countries, including Japan as well. Here's a small introduction of our institute, Brahma Ayurveda.
Welcome to Brahma Ayurveda, Gujarat's first ever multi-speciality Ayurvedic hospital with world-class standards. Founded by Doctors Juhi and Narayan Chahane. We have multiple theatres well equipped for urology, proctology, Ayurveda and Panchakarma. For patients staying over, there are multiple beds ranging from common to VIP with special facilities. Guests receive excellent, healthy food and access to an on-duty doctor around the clock. Here you can receive the best of modern healthcare combined with the age-old wisdom of Ayurvedic medicine. We receive many local and international patients for highly specialized procedures such as the Uttarabasti, an effective cure for urethral strictures, performed in our Ayurvedic Urology Center, the first and only in India. Brahma Ayurveda. Follow the most authentic and updated science of life.
This presentation cannot be completed without thanking especially the Nirvana events and the young dynamic trio. Dr. Abhidhamma Kaninde is a pediatrician at Leicester University Hospital. Dr. Kirti and her husband, Mr. Amit Kumar. So this is really very great to know that on a very short notice, they took like a lot of pains to arrange this. And again, thank you to the Mr. Sandeep of this Nehru Center. They really helped us to arrange this. And yes, our sponsor Mercury Events. Also, I would like to thank all the dignitaries. They especially came to us, Bhamra sir, then Venkata sir, then Raghuvandan sir. So they especially came to support this, especially all the associations of Ayurveda professionals in UK. They really supported the Palita sir, especially he came to attend this program. I would like to thank him as well. And my good friend, Dr. Bhavesh Limbani, his GP, so he is also there with me. So thank you everybody. And obviously the president of Association of Ayurveda Professionals, Dr. Kanchan Nand. So thank you everybody. And obviously the technical team as well. Thank you very much. Now the topic is open for the discussion, so if you have any questions, queries, please, you can ask.
Thank you so much, Dr. Narayan. I can see Dr. Bhamra there, so thank you for coming and joining us. So the forum is open, so if you have any questions, please let us know. And I can see one hand. Can we have light on the audience? Yeah, thank you.
Can I take that?
Yes, please.
Thank you so much. It was such an insightful. I quite like the science that you said, that how our internal energies connect with our gross body. And in that example, you mentioned about Agni, how Agni helps with the digestion. Sorry, thanks. So you said how Agni helps with the digestion, and then you connected that why we should not eat when we are not hungry, right? Now, how does that connect with our routine? Because I mean, we are told to eat 3 meals a day at the right time. Now, even if we are not hungry, will that contradict our Agni function?
Yes, definitely. Actually, the way Ayurveda says, it is officially written in the textbook of Charak Samhita. There is a chapter in one section that says Ekashanam Sukha Parinam Karanam Sreshta. Ekashanam Ekal Bhojanam. That means eating just once a day is the best thing to make yourself happy. You must have heard that famous story of Lord Shiva and Nandi. So when he saw that when Lord Shiva noticed that everybody is unhappy or unhealthy, so he sent Nandi with the message that one should eat just one meal a day and one should have shower thrice a day. So he was just saying, Ek bhojan, teen stan, ek bhojan, teen stan, ek bhojan, teen stan. And then this Narad Muni comes in. He asked, what was this? And he got confused and he delivered exactly opposite message over here. So that's true. And the way I explain that, the digestive fire goes with the sun. So that circadian cycle is definitely very scientific. Everything goes with the nature. So if you don't eat dinner, you will feel definitely hungry in the morning. So it's nature. You must have noticed that all the kids, animals, birds, they feel hungry in the morning because they don't eat too much in the night. So the day on which you feel that you have passed motions properly and you are hungry in the morning, that means your system is perfectly alright.
Yeah, so it also connects with the daytime, and you said about the sunrise and the moon. So it connects with that as well. In Jainism, they eat before the sun
Yes.
sets, so that makes sense with that, right?
Yes, very good.
Okay, I have one more question. I can give other people a chance if you want.
No, you can.
Okay, you mentioned about the energies of Apana, Udana, Samana, and we say that all the time in our shlokas when we feel good. You know, Apana is Swaha, Udana is Swaha, Samana is Swaha. Now how does that connect with the other things that you're saying? That was a little bit confusing for me because.
Fine. Very good question. Let me just one example so you'll be able to relate that. Just one, actually it's a very broader topic to explain, but just one example. It's very common everywhere that most of the cardiovascular or cerebrovascular accidents occur in morning hours between 4 and 7. This is very common. The stroke, the heart attacks, and most of them they occur inside the washrooms. So that heart is the seat of Vyan Vayu, the Vyan Urja, and Apan Vayu. So that person, when that person is constipated and when that person is trying to pass motion straining, when the Apan Vayu is not properly channelized, it diverts and it can do disasters. So that's the example of how it affects rest of the energies.
So Apana Vayu is circulation.
Yes, no, Apan Vayu is that Apan Vayu governs these 5 things.
Oh, okay.
You can just imagine the day on which we pass proper motions. It's really a very nice day. And when we are not able to pass motions properly, then how is the day? The energy levels are very low.
Thank you, Dr. Narayan. I'd just like to highlight on this aspect because when Vedic wisdom, when it is understood, it understood Agni Somiyatva Jagat. The entire universe cosmos is in dual perspective of this. Either it is a quasars like light, supernovas, heart, and then creation, sun and self-luminous. Bodies are the dark matter, cold. So this is what the science. And the same elemental cosmic physiology, when it is built in our energy from this cosmic, nothing but the cosmic dust. How does it represent this bio-environment, as Narayan said about these vatas? And see that dual perspectives of the central body, the physiological heart one way, and then the stomach in another way. Both the places is the fireplace. What you can say that, you say for example, in the Sanskrit, Pundarikena Sadrisham Hridayam Cha Pyadomukam Adhunischa Vitasthyantyena Abhyama Pratishtati Dwara Maharakulambati Lambatyakosa Sandipam. All these Mantra Pushpa narrates, the science did not reach to that extent to understand sinoatrial node and the significant self-autonomous body which controls the entire heart and its units with its own nervous system, autonomous functions, and the spark which generates. Nivara Shukavatanvi Pita Bhasya Tanupama. So it is even said that Nilato Yadamadjasta Vidyaleke Bhaswara. So the glowing of that Nivara means a small fruitlet. You can see, look at in the handy lens, the spike projection, which is the size, they just say that. This is the spark. And how does this spark? For example, the cloud.